Welcome to the recording for the 2025 application for the Lone Star College-CyFair Medical Radiologic Technology Program. My name is Lindsay Brockian, and I'm going to walk you through this information session slideshow to help you understand what it is to be a radiographer, what the technical standards are, what our program entails, and what the application process is. So let's get started. The first thing to be aware of is, what is a radiographer? We're also known as medical imagers, X-ray technologists, or rad techs. So we are a medical professional, and we use X-ray technology to create radiographs or diagnostic images. And these images that we create are there to help the physicians, radiologists, diagnose certain conditions, trauma to the patient, or diseases. Our job is to be effective communicators. We have to communicate with the patient, with their family, with doctors and other medical professionals in the hospital setting. We also work very closely and have intimate patient care with the people that walk through the door. We have to position them correctly, get the right projections that the doctors need to make accurate diagnosis. And then lastly, we're very much critical thinkers. We have to analyze each situation based on what the patient's going through, what they're telling us, the condition of their body at the time, if there's a trauma, or if they're unable to move in a certain way. We have to critically think about how we're going to acquire the images that the doctors need to diagnose. And then lastly, we analyze our x-rays to make sure that they are top quality for the doctors. This slide here is just examples of radiographs. So what a radiographer is trained to complete, to produce for the radiologist, so that they can therefore diagnose ailments and traumas that the patient is experiencing. We are trained to take x-rays of the head all the way down to the toes and in between. You see examples here of shoulders, humerus, spine work, chest x-rays, shoulders, pelvis, and even head work. Now, the qualities listed here are very important for you to consider if you're wanting to become a radiographer. Technology changes in most fields, and radiology is not any different. Our computers have gone from almost no computer with a film x-ray to computer radiography, and then we've transitioned into the digital age. So that's just an example of how technology has changed over the past several decades. It's going to continue to change, and so we have to be able to adapt to that change and be very efficient with working the machines. Compassion towards others, and always willing to provide intimate patient care. Patients come to hospitals and clinical settings when they don't feel good, when they don't look good, when they don't smell good. They're not in the best moods. No matter what they're going through, it is our job as professionals to provide them with ethical and compassionate patient care. We must be critical thinkers. No patient is going to be the same. You're going to have to approach a patient differently to acquire the same x-ray. So are you able to critically think about a situation and be adaptive? Lifelong learners sort of goes along with the changing of technology, but protocols and other items are going to shift. We're going to adapt to certain new techniques or ways we go about getting images and providing care. So are you willing to be a lifelong learner along the way? And last but not least, physically fit. This job will entail an individual standing for long periods of time. 8 to 12-hour shifts is typical for a radiographer. We push portables around. There are surgery machines that are quite heavy that we must take in and out of surgery rooms. And of course, we're going to move patients in wheelchairs, stretchers to tables, and whatnot. So ask yourself, are you physically fit to do the job? So these are technical standards to consider if you're looking to become an X-ray technologist. Please read through these and make sure that you can safely and successfully practice all of them. This is another slide of the technical standards that you should be aware of. Please review and make sure that you can meet all of these qualifications. So this slide is just letting you know where rad techs find employment. The most common location is going to be a hospital setting. These individuals take x-rays of inpatients, outpatients. They go to the emergency department to take care of trauma patients. And then obviously surgery is found in hospitals. In addition to that location, physicians' offices and clinics, standalone emergency departments, and then surgery centers are also locations where a radiographer can find employment. The next thing I'd like to discuss is just letting you all know about the medical radiologic technology field as a career and its stability. So there is a slow but steady growth for our profession still. The last time I checked, it was about 6% every year of a national growth for rad techs. And we're still a pretty large group, the third largest, just behind doctors and nurses. So if you're thinking about this career and you're wondering how stable it is and how much, of a permanent situation it could be for you and your family, it is a good choice. In addition, I think it's important for everyone to know a little bit of mobility within medical radiologic technology. After completing a program such as ours and becoming an X-ray tech, most of the time there's a large percentage of people that work as an X-ray tech for years, a few to, perhaps many, and then they look at transitioning into another modality. On this slide here, you see mammography, computed tomography or CT, magnetic resonance imaging, and then interventional and cath lab. So here are some examples of possibilities for the career mobility I'm referring to. A lot of these do require additional schooling, obviously training, but they are great career choices that are afforded to the individual simply because they were a rad tech first. There usually is a slight increase in pay, and then obviously just kind of a change of pace, which is what some of those individuals who have been a rad tech for a few years now would just kind of want. It's just something perhaps a little bit different. So yes, these are wonderful options to be aware of after pursuing this program and becoming a rad tech. Now this portion of the information session, we're going to transition from discussing the field of medical radiologic technology and what a rad tech does on a daily basis to talking about our program here at Lone Star College-CyFair. The first thing to discuss is our mission. So here at Lone Star College-CyFair, this MRT program is here to provide comprehensive education in a very structured environment. And the goal in this program is to provide job opportunities for individuals that meet the community's needs in reference to medical imaging. Assisting in meeting our mission are the program goals. So here you can read that we have 5 important goals that our program does effectively meet. We develop in our students clinical competencies that they will need to be successful radiographers in the field. In addition to being competent when it comes to the skills, individuals must have effective communication. And so we teach our students the proper things to say and how to address each individual found in a hospital in a professional and effective manner. Critical thinking and problem solving is a must when it comes to being a medical professional. The X-ray tech students who graduate the program are efficient and they are critical thinkers to address any challenges from a specific type of patient situation. Our students, the goal for our program is for them to graduate and be prepared to pass the national certification examination on the first attempt. And then lastly, after graduating and passing the ART registry examination, the goal for our program is for them actually to be able to go out into the community and find employment. So we've discussed the mission and the goals of our program, but now let's talk about the effectiveness of our program. So here are 3 things that we regularly monitor and keep up with. They're called program effectiveness data. And we look at student learning objectives and we check on our students to see, do they pass the registry? Do they find jobs? So the first one is completion rates. So we've discussed that we allow a certain number of students into the cohort each year. And out of the certain number that we allow in every year, how many of those graduate? On average, the past 5 years, 91% of the students who enter the program complete our program. Out of those 91%, the average of 5 years, how many of those students pass the registry examination so they can become a rad tech? 100% over the past 5 years. And then lastly, the ones who actively seek employment, how many of them are able to find jobs in the community and beyond? Our average here at CyFair is 98%. The next thing to consider when you're looking to get into a program is obviously how much is it going to cost. So here's a breakdown for you to look at. I'd like to mention that there is a link I've provided here that takes you to the Lone Star's tuition page so you can see how much each credit would be if you are in district or an out of district student. There are several items on here. Some of them might be more obvious than others. One being books are required. Immunizations and CPR, every student who is in a medical program typically has to complete these as they are required by the hospital sites. Also uniforms, we tell the students what color to buy, what type to get and all that kind of thing. But that's an approximation for uniforms. Background check and drug screen is a requirement for the clinical site. So the student should be prepared to take a drug screen and have a clear background check as well if you are selected into the program. That is a fee that the student must pay. The last few things range from record keeping systems that we require our students to pay for to keep up with all their clinical competencies, evaluations, and attendance records. And then the last few are either test prep requirements or exit exams. And then the last few would be the cost of the registry examination and then the applications for the ART and the Texas Medical Board getting the license. So there is an approximation on how much the program costs with in-district tuition. And this is for the 47, this is with 47 credits, which are just those radiology classes. Not the co-requisites or the prerequisite that was on, or that's going to be shown to you on a couple slides from now. So what's not included that you should consider are the things on the side here. Health insurance is also required for the students to maintain, as this is a requirement from the clinical site. And then the other items, living expenses, obviously, and then maintaining a reliable vehicle is something to take into consideration. Attendance is monitored and required to be a successful student in our MRT program. Now let's transition to a little bit more detailed information regarding the program on a daily basis. So both didactically and clinical is what our program consists of. It's 2 years, 6 semesters. We begin in the fall semester and we end 2 years later at the end of the summer semester in August. During those 2 years, it is a very intensive but rewarding program. The students should be aware of the time that they'll have to allot for coming to class, attending lab sessions, and then going to clinicals. And then in addition to that, being home and studying to prepare for examinations, quizzes, checkoffs, etc. So it's a very time-invasive program that does require a lot of dedication throughout these 2 years. The didactic classes that we offer are all in-person courses. We do not offer online classes or hybrid. We believe that, the student coming to class, seeing the professor lecture, going to lab, being involved and hands-on is the best learning environment for this field. While they're here on campus, we do have a fully energized X-ray lab. We have 3 X-ray machines. We have several phantoms that are there for the students to expose and to see radiographs. We also have a CR machine, which is the machine that is taken into surgery and to assist the doctor in seeing the images as the surgery progresses. So we have one of those in our lab that students use to train. And then lastly, in our lab, we have a wonderful portable machine, which is quite frankly how a lot of imaging in hospitals is performed these days. So we make sure we have up-to-date technology that students can practice on and become comfortable with before they step foot in the clinical setting. And that brings me to clinicals. So we have affiliated clinical locations throughout the predominantly Northwest Houston area, and our students attend several locations throughout the 2 years in the program. This is a very integral part of our MRT program, as what is learned in lecture and in lab is applied in the real world setting. Now this slide provides a breakdown of sort of what each semester would look like. I would like to say the prerequisite is obviously the course that must be completed before you enter into the program, before you even are eligible to apply. You must have the Biology 2404 course completed. The items you see in yellow are what we call co-requisites. These courses are non-radiology related, but required to complete the associate degree. Several students who apply have all of these courses done when applying, and that's how they earn points to better their chances to become students in the MRT program. The courses that are left are RADR, radiology courses. You can see the students take anywhere from 2 to 3 courses every semester. And again, these courses are in person. Several of them, didactic ones, have labs along with the lecture. And then there are, starting the second semester, the student, second, third, fourth, fifth, and sixth semester, the student will be going to the clinical sites to learn how to take x-rays. These clinical courses can range anywhere from 2 days a week, 8.5 hours a day on a Tuesday and Thursday. And then they finish up their last year going to clinical to complete the clinical courses 3 days a week, Monday, Wednesday, and Friday, each again for 8.5 hours. I would also like to add these radiology courses are offered at specific times each semester. Our courses usually begin around 8 o'clock, 8:30, and the courses could end around 3:30 in the afternoon. The courses are only offered once a semester, and this program, you must pass each course to continue on with the program. The first semester, the students do not go to clinical. They take a physics class, a patient care course, and then a procedures course. So the student is well prepared to therefore, starting the second semester, enter into the clinical setting. The clinical times are also, like I said before, either on Tuesdays or Thursdays, and then Monday, Wednesdays, and Fridays. So the days that you attend clinical are also set. The clinical sites are also chosen for the students. And lastly, the schedule for clinical courses, like didactic courses, are also selected for the students. These times for clinicals can range anywhere from 7 in the morning to a couple of our sites have evening rotations that could be around 10:30 or 11 at night finishing up. We do try and make sure that the students have an equal, well-rounded experience in the clinical setting. So we make sure the students go to several different sites to complete the competencies required for the ART examination, and to ensure that they're getting every learning experience needed to be prepared. The next few slides, we will discuss some important information regarding the clinical aspect of this MRT program.